Hey everybody, welcome another episode Insurance 360, and probably noticed something a little bit different. It's not Rob next to me, right?
I'm kind of next to you.
He's sort of in the shot, but not really next to me there. We have our first ever in-person guest here on Insurance 360. Now, you've been on before, but now in person. So Nicky Skubal, everybody probably knows Nicky, who's in the business. You've been around like 3-4 years, right? You've been doing this couple years in couple different ways. But welcome.
Thank you.
In person, Rob.
Our first ever in-person guest.
Yeah.
And you know what?
No pressure. No pressure.
Now, me and Bob normally cheers.
Okay.
So we figured we would do a little cheersy here with you.
My non-branded.
Wait, but first.
What?
We should probably make it a little more official.
We've got you a little bit of a gift to take with you. It's
there you go. So you can do the official cheers with us now.
That's excellent. Thank you so much. Oh,
here, we can throw
what
this
an honor. I'll need that for transport. But oh wow, what an honor.
All right, so we officially
cheers it up here.
There you
Cheers. Cheers. Oh, this is great. Thank you. I appreciate that.
I'm sure that'll be a conversation starter at the airport or something.
Yeah.
Exactly.
Also,
Who were those two guys?
My husband. He might be like, yeah, who are you putting in our who's going in the cabinet there?
Exactly. But I mean, really great for you to be here in person. There's so much going on. I mean, it's perfect timing.
Yes.
Right. We had things like final rule hitting. We've got events going on, a lot of different moving parts happening. I think some things we're going to talk about today are things that maybe not everybody even has on their radar right now, right? I mean, some changes going on in the industry, which is kind of the norm. We always say, change is the norm when it comes to Medicare and what we do.
I feel like I've said change, disruption, turmoil, trauma. Can I add that to the? Because that's how I feel sometimes.
Trauma is probably a good word. There's a lot of trauma going on in our industry right now. But over at ChenMed right now, I mean, you guys are like front and center with the Medicare carriers. I mean, we used to talk about value-based care even just a couple of years ago.
Yeah.
But now it's a big part of what we do. So for everybody out there who maybe when we say value-based care, VBC, you'll see a lot out there. You want to give your little introduction on what is value-based care, how it works, give a little bit to everybody.
Yeah. So, I'm with ChenMed. That's the parent company we have, but we also, of course, have our dedicated senior medical centers and our GenCare senior medical centers. So we're all under one family. And it's really our job to make sure that we're providing more good days to our patients, right? So we work with Medicare Advantage patients who are 55 and older, and we prioritize whole person care. So what does that mean? So we're investing in our patients from day one. And because of the way our centers are designed, we're able to do, complete health assessments on site. We have labs in-house. We have screenings in-house.
So it's one location.
People
come in and they're getting labs.
They're
seeing doctors.
They're seeing their primary care provider. They're getting they're getting an echo. They're getting all screenings done to make sure that we are able to work with them from a baseline and create a comprehensive, personalized healthcare plan with them from day one. And at value-based care focuses on prevention, right? So again, the idea is to keep these patients out of the hospital. That's great for everyone. That's great for the patients, of course, but it's also good for brokers because your healthy members, your healthy clients are going to be with you longer. They're happier, typically because they're healthier. So this is a good thing, right? And so we see our patients, we try to see them at least once per month. We have smaller panels. And what that means is that each provider is able to give that individual personalized attention. And I mean, how many times have you tried to get an appointment? I know I've dealt with this. We've probably all dealt with this and even like I'm thinking about with my parents when maybe they'd make a phone call in December to set up their annual wellness visit for the following year. And they wouldn't maybe be able to get in until April, May sometimes because the doctors are just backed up. Well, we're able sometimes to even do same day appointments.
Oh.
So, we have we want people to walk in if they have an emergency. We're going to get them that care and get them that treatment. And because our providers have smaller panels, we know who our patients are. They know them by name, by sight. The front desk knows our patients, and it's a personalized individual experience that's a lot more, I think it's warmer than your typical
Yeah.
average doctor's visit.
Yeah.
Yeah.
I mean, look, my dad, so he watches this podcast, which he loves our YouTube thumbnails. Thanks,
Yeah.
girls. Yeah, they put me in a wizard costume and whatever they can to make me look even better than I already am. But my dad has to get actually 2 full hip replacements.
Oh, gosh.
But he got into a car accident and it made it worse. So he has to get, he's actually getting it at the end of this month. And the amount of stuff that he had to go through, and he's a low income senior, he's 62, right? He's right on the cusp, but he had to wait like a month and a half to be able to see his doctor, right? I don't know what they would call a hip doctor. Is it like a
Specialist.
Some sort of specialist.
some sort of
right?
specialist? So he had to wait for that. Then he sees him. The doctor tells him he needs to lose 20 pounds or 15 pounds.
Sure.
So then he has to wait. He lost it really fast, but then he had to wait another month and a half. And it's like you see it when people don't recognize it until it hits home, right? And that's my dad. So I see this stuff, and what you guys are doing really, I think, is just it helps seniors centralize their care.
Yes. Yeah.
And it's needed. I think we need to do more of what you guys are doing.
Absolutely. I agree. And, I'm really proud to be part of the ChenMed dedicated Gen Care family, but there are other value-based care providers out there. There's going to be someone who's the right fit for your members, and again, the value-based care model isn't for everyone. Not every person wants to come to the provider once a month. They don't all need to, again, but if for people with chronic conditions, people who are low income, because we know, unfortunately, in America, low income folks typically have one or more chronic conditions. That's just part of the name of the game, for better or worse. And so being able to manage those chronic conditions without some of the stress of going through the traditional channels of providers really can help boost their health, either maintain or improve their health outcomes. And that's what we all want.
Yeah, and we know it's what the carriers want as well. Obviously, if people are getting that preventative care, if they're being seen more often, things aren't getting to a point where there's out of control health conditions going on, it's less claims.
Absolutely.
At the end of the day, right? They're getting better care, better outcomes. And we're hearing the better outcomes a lot. And even in the new final rule, they're changing a little bit, right? Things like the star ratings, they're pulling some of the things back. But one thing that's not changing is outcomes.
Absolutely.
That's what's important. And that's where value-based care is even becoming a bigger part of what the carriers are doing and the whole experience with Medicare Advantage.
I think, it's a great point. In the final rule, the 2027 final rule, there are fewer measures going forward that carriers will be evaluated on. So fewer measures for outcomes, but the emphasis is now higher. I think it's tripling the weight on clinical measures. So quality management, value-based care. And, as brokers, I know you're not necessarily thinking about stars maybe until a client asks you, what's the star rating of that plan? Right. But think about the ways that stars, because that can determine the reimbursements that the carriers are receiving, and that determines the richness of a plan. So it really is, we're all in this together. And so when you think about, tripling the weight of improving or maintaining physical health and mental health going into 2027, as brokers, you have a lot of influence on your members. And so if they are looking for a primary care office, if they need a new doctor, talking to them a little bit about value-based care, I would just say, have them set up a tour. It's harmless. It won't hurt them. They can come in, see if the center is the right fit for them. And if they like it, great. And if they don't, okay. That's all right. It's not for everybody. But the point being is that if you think about the ways you can help offer your patients more solutions, or your members more solutions, that ultimately has a ripple effect on stars outcomes, which means the following year, you may be able to offer more robust benefits. So it's that cycle.
Absolutely. Really important point on the star rating, especially when we talk about things like the funding that the carriers are actually getting. And
now he's saying this with funding with kind of air quotes here.
Yeah, the original measure that came out was 0.09%. Did you hear that?
0.09.
Obviously, when we look at the cost of healthcare and what healthcare rises year over year, we weren't real happy about that, especially the carriers weren't real happy about that. Now the official number came out, and it may sound a lot higher than 0.09.
It is. It's better.
2.48, still not quite what's needed, right? You're talking, if you talk to the carriers, the cost of healthcare, you know, 5-7% year over year.
Minimum.
So 2.48, when you're talking about keeping the products robust, the extra benefits like dental, vision, hearing, some of those kind of things that are in there.
Transportation.
Talk about, we're still going to probably see some changes. 2027 is still going to see some of that trauma that we saw in the last
Keyword here, trauma.
That
It's going to be triggering, folks, I think.
It will be triggering. We hope some of the pullback in areas where the footprints are have started happening. Maybe there won't be as much of it this year, but I would not be shocked if we're going to see more of it.
I don't work for a carrier any longer, so I can't speak directly, but I can tell you from experience, everybody's life costs more now. Everybody's, right? So we're all facing increased costs lately. Obviously, we've all seen the news. We know medical inflation is up. We know that utilization being up is a good thing if people are seeking out care. That's what we want.
Right.
But at the same time, unexpected bouts of flu, for example, when maybe people aren't necessarily getting their flu vaccine. And yes, the flu vaccine.
Learned my lesson there.
Yeah.
Oh, I think I told you at our show. I died for like a week.
Now, the flu vaccine doesn't necessarily mean you're not going to get the flu, but it can help keep you out of the hospital. So if you think about record numbers of members out there who, for whatever reason, chose not to get a vaccine this year, didn't work out, forgot about it, whatever the reasoning, but then they got the flu, and because they're seniors, they're elderly or older, and maybe they have some of those chronic conditions, it hit them harder than it might hit an average person.
Right.
But here again, Rob, perfectly healthy, not a senior citizen as far as I'm aware.
I mean, the gray hair might tip you one way, but I am not.
But it had you out, down and out, right? And you were home, and you were bed bound, right? You were sick. So now imagine, the ripple, again, we use that ripple effect term, though, of how many thousands of patients and members and what that costs the health plan. And that's money that they can't use in dental, hearing, vision. It's money that doesn't go to transportation, and it's money that has to be redirected to care that maybe they weren't anticipating.
Right.
So again, I'm certainly no actuary and no expert on this, but I don't think the streamlining and the tightening up of plans is going to change. I don't think we'll see one of those blockbuster years.
I still think it's going to be one of those years where we're going to see more of what we saw for 2026.
Yeah.
Maybe we're a little better prepared as an industry for it, right? We're sort of making those things.
Look, all I'm saying is at the end of the day, I don't think you need a GLP-1. You just need to get the flu. you lose weight real quick if you're just not eating.
Yeah, this is true. This is true. But,
don't take any diet or health tips from Rob.
We need a disclaimer. The girls will handle that for us.
Yes, yeah. But that's where things like a value-based care facility probably is going to promote you getting the vaccine.
Yes.
And listen, everybody's got their. We're not political on the show. Listen, everybody's got to talk to their doctor, make their own decisions, all that kind of fun stuff.
What's right for them?
Another disclaimer, girls.
Yeah, but at the end of the day, when we talk about the amount of care that's being given, we talk about the claim exposure and some of those things. We really are dialed in more from that point of view. We know we want healthier individuals.
Absolutely.
And we know if they're seeing the doctor more regularly, more likely that they are a little healthier.
Exactly. So again, we'll go back to, working with Chen Med, Dedicated, and GenCare Senior Medical Centers. Our goal is to keep people out of the hospital. So that's why we're offering, they have our doctors' phone numbers. They can call them. They can say, do I need to go to the emergency room? You know what? No, you don't, because you can come meet me right now. You can come into the center right now. Let's see what's going on. And if you do need to go to the emergency room, of course, that's where you're going to go.
Right.
But we can probably help you and walk you through whatever it is you're dealing with and help you get on the path to recovery and better health. And so again, when you think about that, the long-term effects, it costs a heck of a lot more to go to the emergency room than it does to see your doctor.
Yeah.
So, and that's, again, I'm going to use this phrase one more time. I think it'll be should this be the name of the episode? The ripple effect? The ripple effect is going to be, the fewer emergency room visits, the fewer hospital admissions, the less the health plan's paying out for those claims, the more they can focus on preventative health. Yeah.
Exactly. And then a big part of this is also the network issues, right?
Yeah.
So these providers are all wanting to get paid more,
Of course.
right? They probably are like 0.9 to 2.48. You can just give us a bunch more money now, right? We'll all get back in network.
Skim a half a percent off the top.
And the reality is probably going to see some changes on providers and whatnot still over the next year. I expect that to be the case. So we'll have to more to come, I'm sure, on that once we start seeing some of the plan information coming out. But I expect that more of that will absolutely happen just because of the costs overall. But if we can keep people healthier, hey, it's a win for everybody.
Absolutely.
You know, that's the way it is.
Yeah, couldn't agree more. And before we get off the topic of the final rule, it wasn't all doom and gloom, right? I mean, there was some positive things. 48-hour scope rule gone. I mean, I feel like every 2 or 3 years it's gone and comes back.
Boomerangs, right?
I wonder what causes that. But then there's some other things too, right? You don't have to hold on to your call recordings for 10 years. It was reduced to 6. And in fact, if you have an AI note taker, which a lot of people do, I use Ring Central. It actually will transcribe all my conversations. You actually only need the audio or the transcript if it's years 3 through 6, which is good.
That's a
Exactly.
good tip.
It's a big change. It was a cumbersome. You're thinking
Yeah.
10 years. Now remember, I think it's still 10 years, right? That we have to keep copy of the enrollment information.
Yeah.
Yeah,
But,
still 10 years there.
but the recording is really was a little onerous on everybody, right? It was one of those things where, not everybody wants to have that kind of technology. Now here in our office, we provided those type of recording platforms, but it still had to be maintained.
Yep.
You know, so big change. You're good point.
And I think one of the biggest changes is the ability to do an educational event
Yes.
and then a sales event. I mean, that opens up a ton of just, obviously over the years for us, it's always been, all right, educational event. And this past year, you needed 12 hours in between facilities. So it was like you're doing double events, right? If you wanted to do that. Now you can hold a 2-hour long event. 1 hour is educational. Let everyone know if they want to leave, they can. Next one, sales. And you can talk plans. I mean, there's just, I think that's probably one of the biggest changes outside of the scope of
And
appointment.
Rob, who's a great partner for educational and sales events?
Who's that?
That would be ChenMed and GenCare Senior Medical Centers, because we have community rooms. We have the ability. So there's lots of opportunities at no cost to you, where we can partner together if we're going to bring in refreshments and things like that. But there's a lot of opportunity for brokers who want to work with us in that capacity. Think of us beyond just a doctor's office. We're also a community center. We have people coming in. Sometimes our patients just come in and take an exercise class or hang out. I mean, it's a nice vibe.
I think
in
that's
there.
what people don't realize about these facilities. If you haven't been to one, you should just go,
please,
and go and see one of them.
Email me. We'll get you a tour.
These are like a clubhouse for seniors with doctors in them, and they're able to do so many different things in there. Which is really cool. But if you haven't seen one, you definitely should. And if you're not sure if one's in the area, you can reach out to the team here.
Yeah.
I mean, we have the information on all of them. And if you're using our Connect for Insurance, you actually have the ability to look them up in any location in the country. So there's a lot of ways to go about doing it, but just reach out to the team and
absolutely.
we'll definitely
111 clinics across the whole state. So
they're all over.
That's huge.
Yeah,
I mean, because you think about it, right? I mean, what's the number one reason outside of health stuff that our seniors are declining, right? Cognitive.
Yeah.
And when you're getting, you got to be social. You got to get yourself out there, and you have these facilities they can go, they can make friends, they can talk. And I think that's half the battle is just meeting people. Because we're adults. It's difficult to meet new people sometimes, right? And it's even harder when you're past that 60-year mark.
Absolutely. And I'll never forget when I first started the role, walking into one of our Atlanta super centers, and it was a rainy October day and it was grim outside. It was just gray and overcast. And I walk into the center and everyone in there is smiling and laughing and they're making fun of something on TV as a community. And they're all just, they're waiting for their appointments. But I've never been to a doctor's office.
No.
I mean, most of the time your doctor's office experience is neutral. But you wait, you have your appointment, you are on your phone.
It's a very sterile environment.
But you're hanging out. If you have someone with you, maybe you're chatting with them. But most of the time it's a pretty bland, or it's irritating because your doctor is late and you're in a hurry and you were counting on them to be on time. But I've never been in a doctor's office, and I've seen this multiple times now throughout the country at our centers where people are, they're enjoying themselves. They're having a nice time. The front desk staff, they all know them, so they're chatting with them and they're checking in on them, and it's a really nice atmosphere. So again, to your point, it creates that sense of community that maybe they're not getting in their lives, especially if they live alone, right?
Yeah.
So, yeah.
It's a great point. And to talk a little bit more about those couple things with the final rule,
Oh, yeah,
because
sorry.
We get off track here. It's
Yeah.
okay.
Yeah,
It's okay.
we talk about doing the meetings there, and you definitely want to be able to utilize these type of situations. Like if you can get a room like that, bonus, right?
Awesome.
And we have marketing funds to do 265
and
all
now
kinds of
with the
things.
rule change,
Yeah.
we just call them common sense changes. Like, listen, compliance has not changed.
Correct.
What you need to do to make sure you're being accurate and compliant, it has not changed. But some of those things that were just like a little bit crazy, like somebody would, have to wait 48 hours before you could do it, like this cool-off period. Like some of these things seemed a little, there for, I don't know, bureaucratic sake. I don't know, whoever's making those decisions. So some common sense, I think, is back,
Yes.
which is what we like. We still got to do things the right way. Even the marketing stuff. You're allowed to say things now like best, most comprehensive.
Now that change,
I don't like best.
I think that one might be a little bit. I wonder who was really in favor of that part of the rule.
Yeah. Before you do it, send it to us.
Yes.
Let us look at it. It's one of those things where it's not supposed to be misleading.
Yeah.
Right. We still have to make sure that we're not misleading anybody.
I can't wait to see that first piece, and it's like an old school 80s where it says best with like the yellow like triangles that go all around it, with flashing lights, and you're like, look, we understand there's a gray area in our business, but we also do understand that from a compliance standpoint, we don't like to play the gray area that much. You want to do the good thing and stay on the right side, because at the end of the day, you don't want to be that guy that has to go to CMS and explain why you use something. And a lot of times they're not listening to you. They're listening to the member. They're listening to the people that reported that incident, right? They're not going to take your word for it, even if you had necessarily good intentions.
Yeah, exactly. But we want to talk a little bit about too, I think, which is really, it's one of those things that's, I don't know that it's on everybody's radar. So we love an acronym.
Yeah.
We always love an acronym in the Medicare world. So SSBCI. Let's talk a little bit
I
about
don't even know what that acronym stands for. Supplemental
benefits.
Senior supplemental benefits for the chronically ill. Is that
For
right?
the chronically ill.
Yeah,
Yes.
chronically ill. Yeah,
Yes,
I know the
she's got it.
I don't know the two S's, but
So we've seen the change to this over the last year. So chronic plans are becoming more prevalent out there in the industry. But how you get these benefits, what these benefits are going to give to individuals, and how one plan could give different benefits to one individual versus another, how you qualify for them, all these things are in the new final rule. And we were talking about it a little bit earlier, and it's just fascinating to me. I think if you're an insurance agent, get ready to take some notes here, because you've got to pay attention to how the changes are taking effect.
Yeah, I'm going to refer to my notes, because I want to also preface this with the changes to the SSBCI benefit administration. There are still questions the carriers are going to have. So whether it's their government affairs, their legal, their compliance teams, they're going to still be going to CMS for clarification. So this will be an ongoing understanding, so again, be out there, listeners, make sure you're talking to Pinnacle, make sure you're talking to your broker managers to get the latest updates, because what I'm going to share right now about how this is changing is really high level, but it's really important because I think we all saw the disruption and the trauma of when VBID went away. And so VBID, the value-based insurance design, those funds were what paid for the flex card, right? So that allowed, the food, the healthy food, the utilities, the transportation, and to be able to take that debit card in and use that. And so when that went away, what we saw this year was that SSBCI benefits stepped in. And so for most duals and for all CSNP eligibles, they were able to qualify and still get that flex card, right? So we saw a little disruption there, but I think depending on the numbers, it's 90 to 94% of duals were qualifying. So it wasn't a huge number of people who missed out on those card benefits.
Yeah.
But going into 2027, there are new requirements. So I'm going to just read from my notes so I don't misspeak, but the eligibility criteria is stricter, and each carrier now has to independently verify eligibility. So this is a little bit different. Now, we know some carriers this year allowed for member self-attestation. It's my understanding that that's no longer going to be allowed. So if someone were to say, hey, I start this plan on January 1st and I have type 2 diabetes, that's not going to cut it anymore, unfortunately. Also, chronic condition data alone is not allowed to guarantee that card. So qualifying for a CSNP plan alone is not a trigger automatically like it has been this year. So that's a change, right? And nor are, it's my understanding, still again, got to make sure some of this is confirmed by our carrier partners, but that chronic condition claims are no longer allowed. So let's say you've been on a plan for 2 or 3 years and you have AFib, and that has qualified you for as a chronic condition. The plan's no longer going to be able to point to those claims and those diagnoses and say this person has this chronic condition. So there's 2 components going into 2027 for SSBCI verification. So of course they have to be chronically ill, but they have to meet all 3 of these statutory requirements. And I want to preface this again with each carrier is probably going to interpret these statutory requirements a little bit differently. So that makes it fun for everybody, right? So 1, they have to have a medically complex chronic condition. 2, they have a high risk of hospitalization and or adverse health outcomes. So high risk, that's a very vague
Sort of like saying the best plan.
Yes, exactly. Exactly. And again, it's up to each carrier to determine, does that person have a high risk of hospitalization or adverse health outcomes? And the third prong of those statutory requirements is the member has to have a need for intensive care coordination. Then, by providing that SSBCI benefit, the carrier has to have a reasonable expectation of maintaining or improving that overall health of that chronically ill member. So again, that's going to be up to the carrier to decide if we give them this benefit. Will they, 1, is it going to keep them out of the hospital? Is it going to keep them from adverse health outcomes? Do they need intense care coordination? We know there are people living with chronic conditions that don't need help with it. They've got them managed. They're fine. Fine being a subjective word, but they don't need someone to talk to. They don't need a care manager every week or every month even, or maybe even every year.
Yeah.
Their provider is helping them. They're maintaining their health. So does that knock those people out of eligibility? I don't know. That remains to be seen. But again, then will the benefit maintain or improve the overall condition? Now, here's a couple of other things I want to share. Because when you enrolled people for January 1st, again, with the corporate or with the carriers that allowed self-attestation, a lot of times you could have, let's say you enrolled someone in October for 1/1. They could call into that carrier maybe in November and say, hey, I'm type 2 diabetic, or I have ESRD, or whatever their chronic condition was. And then starting in January, they'd have that card available to them. That's not available anymore. Now, because it's not self-attestation, eligibility may be determined prior to their effective date, but how that's going to be done is going to depend on each carrier. There's no more grace periods, though. So it's not going to be automatic. Some carriers gave everybody the card, and then they had to maybe go get a doctor's note to prove that they had that condition. That's not going to work anymore, right? So,
wow.
And then here's the other kicker, because just when it's getting good, every SSBCI benefit, excluding OTC, so OTC is going to stay the same, has to have its own written policies and eligibility criteria. So what does that mean? Let's think of a common flex card that has healthy food, utilities, and maybe transportation. Each one of those benefits is going to have a separate eligibility criteria. It's no longer bundled together. There's an individual threshold. That is a big burden for the carriers. And so I don't know what's going to happen. My crystal ball broke years ago, but I can imagine carriers, for simplicity's sake, streamlining down to maybe just offering one benefit, because to try to manage that eligibility verification and then be able to be audited later on, if that's were to happen,
Right.
and prove that this person, Rob here, he qualifies for healthy food, but he doesn't qualify for utilities, but Bob qualifies for both.
Right. Two people on the same plan, but one getting different benefits there.
Two people in the same house, Bob.
Yeah.
I mean, yeah.
So imagine you as the insurance agent talking about these benefits, talking about you get this, this, and this, but the husband gets all 3 and the wife gets 2 of the 3.
Yeah.
That is going to be
it's
not good.
challenging to administer that. And imagine the conversation when that individual calls you back and says,
Yeah.
you told me we were getting this. My wife's not getting it now. It's a slippery slope. So to your point, the carriers could very well make it that it's just one benefit that they're getting. Maybe it's the healthy food. Maybe it's
that seems to be that. I mean, that's typically the most widely used. I mean, people call it food cards, right? I mean, that's what you hear in the street when we're out in the streets. But so I think that again, anything could happen. But that would be if I were trying to streamline something that is this complicated. Because again, we talked about this earlier. The final rule came out last week, but bids are due the first week of June. Carriers have a lot of scrambling to do right now to build, finalize the build of their plans, make sure that they're all ready to go to CMS and get approved. And so adding in all of these additional measures is tough. And I have a couple other things to share. Now, additional burdens on the carrier.
All right, hold on. Let me
take a drink.
Right, and this is not water. The rule is if you don't know it, if you just blow on it, they think it's like coffee.
Oh, yeah. This is water. I'm good. I'm straight and narrow.
I got you. It's water.
So the reason this is important to you as brokers is again, when we talk about the way the administrative work that a carrier has to take on, the cost to them, not in people hours or AI hours, human hours, whatever it is, but also the dollar cost, that affects plans, right? It affects everything that they do. So going forward, again, and this is still open to be finalized due to interpretation, but all supplemental benefits, including those received through a debit and flex card. Now, I interpret supplemental benefits to be dental, hearing, vision. That's my interpretation. So again, remains to be seen, but they have to be included in the member's explanation of benefits, EOB, with a detailed transaction history. Now, think about that. So it's fairly easy, an EOB will show, you went to your PCP or you had physical therapy or you had an echo or whatever. We expect that and that comes. But now if you went to a local, drugstore and spent some money and got some vitamins, that's got to be on there now. Now, if you go get a cleaning at your dentist, as I interpret it, that has to be on there now. And that's pulling
a little bit cumbersome.
That's cumbersome. Those are different systems. And think about it too. A lot of carriers are outsourcing. I mean, obviously they have their provider network, but they're outsourcing dental, they're outsourcing hearing. Those are different types of provider networks than a medical provider network. So there's a heavier lift there to get that information into their system, which of course they have because they're paying claims, but then to translate it into their EOB system. That could be cumbersome, right? Another one is that OTC items must be clearly and explicitly evident to all members. So carriers have to publicize a full list of allowed versus prohibited OTC items. Now, they kind of do that now. They have their catalogs and things. But at the same time, I mean, we've all heard from seniors or from members who've gone in and said, I couldn't get this brand, but I could get this brand or,
Sure.
We've all heard that. So this is going to put additional restraints, I think, on carriers. And I wouldn't be surprised if we see the OTC. Again, this is my interpretation. I want to be really clear about that. But I wouldn't be surprised if we see the OTC opportunities restrict a little bit, again, to make that easier for a carrier to manage, because it has to be up to date and available most likely on their website. But again, probably in some sort of written document should a member request that, because we have to make sure that, they're getting what they want.
Yeah.
And then also in addition to that, SSBCI eligibility and all SSBCI benefit eligibility criteria must be publicly posted. Now, a question I asked somebody was, does that have to be posted by 10/1 or 1/1? And they weren't sure. So again, we'll hear from our carrier partners, but that'll make a difference to you, all of us, really, because if it's not publicly posted by 10/1, if they don't have to, it'll make it a little more complicated when you're having those conversations with your clients about, hey, you may or may not qualify for this card. But I think my main takeaway from this, and it's going to be an adjustment for our DSNP, our low income, and our CSNP members, is we've got to stop leading with the card, because you can't guarantee that whomever at any carrier is looking behind the scenes and interpreting data that you're never going to be able to have access to because of PHI. They're not going to give you that claims data and say, well, Mrs. Jones had this happen on X date, and this is why we determined she did qualify, while her husband doesn't. They're not going to give you that, and you're not going to be able to answer your member. So
that's a big challenge, because I mean, nobody wants to have the negative experience for the beneficiary,
No.
right? Because it's going to lead to unhappy individuals. You're going to lead to complaints and all these other things that are just going to be adverse at the end of the day. And then getting the individual into the right plan at that point when it's down the road. How do you figure that out? You know,
Not to mention, might be cause of so many divorces if the husband gets an extra thing that the wife doesn't.
Yeah.
And I mean, but I know I'm being funny, but that causes turmoil in the house. I mean, just the trickle down effect of, I mean, think about it, right? How did they determine all of these little rules and regulations without pulling back?
Yeah.
I mean, the accounting that they would need to get this stuff on the EOB, which I mean stands for explanation of benefits, by the way, just so if you're new to this and you're hearing it, which we've all gotten at some point, but like, how do you dictate that? Right?
Exactly. And
Logistically, think about what they would have to do. It's the same thing with the, call recording logistics, right? It took that 2 or 3 years and it's still kind of funky, right? I mean,
Yeah.
I don't know how they're going to do it, but I think just like, all the changes with Part D over the past couple of years, at the end of the day, it trickles down to the members, and the members are the one that really gets hit the hardest.
Absolutely. And so I think the important takeaway here is, as you're building your business plans, once you get your plan details and what's going to be available in your market, a lot of times when you look at your D-SNP and C-SNP members, one of the top things you would lead with is X amount of dollars on this flex card.
Yeah.
That's no longer a guarantee. And so you really want to think about how you're presenting and positioning plans and really get back to the old school days of, guess what? This is why this is the right plan. This is why this is the best plan for you. And it's not because you may get this dollar amount every month. Now everyone's still going to get OTC who, if the plan has it, that's not part of those SSBCI qualifications. But I mean, frankly, I don't think anyone is choosing a decent plan these days because they're getting, $400 a month in vitamins and sunscreen. It's because it's going to help them take care of some of those, social determinants of health needs, like their utilities and their food. So you just want to start thinking about, how would you position a health plan if the food card doesn't exist anymore? How are you going to sell that? And how are you going to say this is the best plan for you, with the assumption that person may not qualify? And that's a big change. And I think it's really important brokers start thinking about that now. Obviously, if you're selling now into lock-in period and you've got SCPs, you've got aging in, you could still talk about it. You should still talk about it, but it might even be a fair warning to start to say to your patients, our patients, your members, this could change. May not, but ultimately the broker's not going to be able to explain why.
Yeah.
And
it's a big deal. We're talking a lot about these changes, and I think a really important point is that the carrier interpretations.
Yeah.
We're going to have to wait and see some of that before we can really kind of scope out how this is all going to work. At the end of the day, right now we're sort of digesting this info, but there's going to be a lot to take into account over the next several months.
And I do want to say too, hopefully, the carriers, obviously people who have legal minds and compliance minds, it may not be as harsh as it sounds right now, but I think it's important for us to think about it at this level and hope that it's a better outcome, because we need to be prepared. And if it turns out that it's easier, that they've figured out a couple of blanket eligibility things that are going to solve for some of the plans, again, they're going to hear back.
Right.
They'll know this. We're still in very early days, but I think it's really important to just have this on the radar, to start thinking about how you would present to patient or to members if this wasn't available. It's not a guarantee, because there will be changes regardless. It's just we don't quite know the ripple effect of how that's all going to lay out. And again, to like Rob said, it's every carrier is going to be different, so that's going to require that deep dive education, because one carrier may do it quite differently than another.
Yeah. Rob, a lot of webinars we hold, a lot of trainings we hold. We'll continue to do that. You got to just make sure, just follow, keep an eye on emails that we send out. We'll figure out each of the carriers and what they're doing. We'll get the experts on and give explanations, and we'll have it mapped and planned out, right? The best that we can. Right, from the carriers, and we'll know how each one is doing, all these different things. So you just got to keep an eye on everything and make sure we set all this stuff up.
Follow us on social media, people. We post stuff every day. Some of it funny, some of it more often than not educational.
Yeah.
We have experts like this on our show here to educate you and us. I mean, I learned
Yeah.
a couple new things today before we even started. So
Well, I learned from you guys. So
I'm sure Nikki be glad to jump on with us again, whether it's a webinar or whatever it may be, just to give some here what we know
Absolutely.
now, like we didn't
Absolutely.
know 2 months ago.
yeah,
So we'll make sure we'll bring in everybody up to speed on that, and then the different events that are out there. We as an industry will be gathering information. I know we have Medicarians
Yeah.
coming down the road here pretty quickly. I don't know that a lot will be figured out by then. You know, like you said, maybe June, July, August will probably be when we'll start getting some more details on a lot of this stuff.
I would be curious. There may be a panel at Medicarians for those who are attending that at least starts to talk about it. You may or may not, but it might be too early. But I think there'll probably be a final rule panel, so they may touch on it there. So
absolutely.
Yeah.
Absolutely.
yeah,
So,
a lot more to learn.
yeah, there's always more to learn in our industry. This is what makes it so important for us to be diversified in what we do. We always talk about making sure that not only sell Medicare Advantage, but you know the D-SNP rules, all the C-SNP rules. Do you have your Medicare supplements, that you can sell? Do you have your ancillary, Rob? Ancillary. Right, hospital indemnity plans and cancer plans and all these different things, because more than ever, you're going to have to figure out with each individual client what's the best scenario for them.
I got to tell you, every year I say to myself, if they had one more acronym, and they do, they always manage to find another acronym. So, at the end of the day, I think you got to get comfortable with it. The changes this year some are bad, but
Some are great.
I'm playing on the other side too. Some really great changes that I think will have a drastic impact on your AEP and going forward for 2027. So it's not all doom and gloom, people. Let's get happy. Before I know it, it's going to be certification season.
Yeah.
And we're going to be talking about 2027 and then 2028.
We're not talking about AHIP yet, are we?
They actually
April, isn't it?
should just announced June 22nd.
June 22nd.
Yeah.
Get ready.
Is that?
But we'll pray this. There'll be a little bit.
It's normally a
Easier.
Tuesday. Let me look. I don't know why I knew that. It's a Monday this year.
Start your week off with AHIP.
Great.
There you go. Yeah, but we really appreciate you jumping on. I know there's so much info and it's just flowing out there. Make sure that if you have questions, you reach out to the team. We'll do the best we can to answer. Not everything is black and white right now as we're talking about all of this, but as it becomes clearer, as clear as we're going to get, we'll make sure we get everybody the information, right?
Yeah,
Absolutely.
And I do hope, everyone out there, if you live in an area where we have centers, please take us up on the opportunity, come in, have a tour, work with our market sales manager, see how we can work together. We do have marketing budgets. We have opportunities to help you be out in the field. And of course, we have grassroots opportunities as well. So take advantage of us as a partner, not only in taking care of your members, but to help you build your book or retain your book. So please reach out to us because, again, more good days.
When all this stuff's going on,
yeah,
we have extra tools to have happy beneficiaries. Take advantage of.
Yeah, please.
Absolutely.
Yeah, got to do it.
All right, everybody. We're going to wrap it up. Have a great day. We appreciate everybody, and there will be more to come. Thank you.
Thank you.